consideration and compassion. Shiatsu has two major features. First, it can be considered the very starting point of medical treatment, in that it is a therapy that brings out the inherent powers of regeneration and self-repair of the human body. Second, Shiatsu is at the same time diagnosing, and this diagnosing is at the same time treatment, so that to carry out Shiatsu therapy constitutes the diagnosing of ailments and also treatment of the ailments too. Today again, many people flock to the doors to receive Shiatsu therapy. Each spring, new students from throughout Japan gather at the Nippon Shiatsu School, the only institute in Japan for Shiatsu training, where they attend the solemn and dignified entrance ceremony that opens with the national anthem of Japan. This year's ceremony was the 23rd since the Nippon Shiatsu School was founded as an institute specializing in Shiatsu training. Resolution, practice and continuation. Three words Namikoshi emphasizes to the new students every year. Resolution is the individual's firm determination to become a Shiatsu practitioner. Practice refers to wholehearted devotion to training until the objective has been achieved. And continuation refers to sticking with Shiatsu all the way without losing heart midway. Tokujiro Namikoshi describes the severity and also the joys of the way to Shiatsu eloquently, as if he is speaking personally to each new student. Attending the entrance ceremony was one of Japan's most famous television personalities, who, a great admirer of both Tokujiro Namikoshi and Shiatsu itself, delivered a highly unique, inspiring address to the new students. As soon as the entrance ceremony was over, the new students immediately attended their first class. The students will be receiving lectures on medicine in general from lecturers who are specialists in many fields: anatomy, pathology, and medical law. The students learn the actual techniques of Shiatsu, taking turns to serve as the patients. For a period of 2 years, the students study the spirit and soul of Shiatsu and its techniques. In the state examinations, every single one of them passes with flying colors, and now the graduates of the Nippon Shiatsu School go forth to serve their fellow citizens as practitioners of Shiatsu. Let us now discuss the basics of Shiatsu therapy. First, the pressure points on the body. We start from the anterior neck and go to the posterior neck, the hands, the legs, and the feet. Next comes the back of the body. We go from the back of the neck to the back, the hips, the buttocks, then to the Namikoshi pressure points, and then to the soles of the feet. There are a total of approximately 700 pressure points on the entire body. Pressure is applied to these points while feeling them with the fingers. We have discussed how to determine the pressure points for Shiatsu on the entire body. Now we would like to explain how to use the fingers. In Shiatsu, the thumbs are used mainly. Therapy carried out using the thumbs is referred to as Shiatsu thumb action. Let us show you how it is done. Avoid allowing the thumbs to curve backwards excessively, but try to lower them. Do not apply the pressure in jabs, but let the pressure build up naturally. This is Shiatsu thumb action. Now for Shiatsu three-finger action. The index, middle, and ring fingers are aligned. As indicated by its name, Shiatsu three-finger action is carried out using 3 fingers. The three fingers are aligned together, and this action is used especially for facial therapy. Take care not to let the nails of the fingers dig into the skin. Now for two-finger action. The middle finger is placed on the index finger. This action is used especially for shiatsu therapy on the nostrils. 1, 2, 3. 1, 2, 3. Now for palm pressure. Palm pressure is applied by the palms of the hands and is used for shiatsu therapy on the abdomen. It is very important that the pressure be applied straight down with the arm positioned perpendicularly to the area being treated. Apply the pressure firmly and steadily. This is shiatsu palm pressure. These are the basics of how the fingers and hands should be used. We shall now discuss shiatsu, first with the patient lying on his side. The patient lies on his side with the upper leg allowed to rest on the floor in front of the other. This is the position to be taken. Shiatsu is applied to the front of the neck. There are 4 pressure points here. These 4 points are along the inner edge of the sternocleidomastoid, where the carotid, sinus, and common carotid artery are located. Pressure is applied to these points by the thumb. One, 2, 3, 4, repeated 3 times. Now for shiatsu on the medulla oblongata, or base of the neck, between the base of the skull and first cervical vertebra. The thumb is applied to the medulla oblongata in this way. Support the forehead with the left hand and steadily apply pressure diagonally in the direction of the forehead. 1, 2, 3. Next is the upper part of the scapula or shoulder blade. If strong pressure is to be applied, one thumb should be placed on top of the other, the elbows extended straight so that the weight of the body can be added to the pressure and the pressure applied in a diagonal direction. Apply the pressure so that the force is directed in a diagonal direction and any stiffness will be eased effectively. Next is the intrascapular area, the area between the shoulder blades. In the intrascapular area, the pressure is applied to the region above the muscle between the scapula and spine. There are 5 pressure points and both thumbs should be used. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. This process is repeated 3 times. Applying pressure to this area is effective in the treatment of ailments of the respiratory organs or of the heart. Shiatsu on the back consists of applying pressure to 10 pressure points from the 5th pressure point of the intrascapular area downwards to the pelvis. Extend the elbows straight out and apply the weight of the body. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. At this time, take care that the pressure is not inadvertently directed upwards. Apply the pressure straight down with the elbows extended. If anything, direct the weight of the body in a slightly downward direction. The therapy concludes when the fingers reach the pelvis. This concludes the back. Next are the Namikoshi points, named by Professor Tadao Mitsui of the School of Medicine Keio University, the most prestigious private medical school in Japan. They are located approximately 2 centimeters above the corners of the ilium or anterior superior iliac spine. The thumbs are positioned in this manner and pressure applied upwards. A hard spot will be felt. The point where the hard spot or superior gluteal nerve is felt is the Namikoshi point. Both thumbs are used, one placed on top of the other, to apply pressure upwards. It is extremely painful, but nonetheless, it is an extremely effective pressure point for treatment of such complaints as sciatica, menstrual pains, constipation, diarrhea, or bedwetting. We shall now move on to the backs of the lower limbs. The first pressure point on the rear side is at the iliac. The points that the heels touch when a person kneels is where the ilium is located. There are 10 pressure points starting here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now pressure is applied to 3 points at the back of the knees. 1, 2, 3, 1, 2, 3. Now for 8 points from here to the Achilles tendon. 1, 2, 3, 4, 5, 6, 7, 8. Now the Achilles tendon is stretched. 1, 2, 3, 1, 2, 3, 1, 2, 3. And finally, pressure is applied to the arch of the foot. This area is connected directly to the kidneys. 1, 2, 3. This wraps up therapy for the backs of the lower limbs. Now for shiatsu therapy with the patient lying down face upwards. We start from the upper part of the thighs. Application of pressure to the upper parts of the lower limbs begins from the groin. Here there are the inguinal ligaments, and so palm pressure is used on 3 points. 1, 2, 3. Repeated 3 times. 1, 2, 3. Once again. 1, 2, and 3. Next come 10 pressure points from the groin to the kneecap. Both hands are used for the upper sides of the thighs from the ilium to a point just before the kneecap using both hands. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now the kneecap. The palm of the hand is applied in a rotary motion. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now for the first point of the lateral lower leg, a spot below the kneecap. Both thumbs are used with the other 4 fingers gripping the inside of the leg firmly as if digging into the leg. This procedure is repeated at a total of 8 points down to the ankle. 3, 4, 5, 6, 7, 8. And finally, holding the ankle with one hand, envelop the fingers of the other hand around the toes of the foot and then move the joints of the toes back and forth quickly 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now bend the foot backwards firmly and then lift the knee, lift the ankle and stretch the leg out. After the leg has been extended as far as it will go, bend the knee all the way in. And then return the leg. This completes the lower limbs. Now for shiatsu therapy on the upper limbs. This form of therapy is highly effective when the hands are tired or when the hands become numbed. The first pressure point is in the armpit right here. Here there are a total of 6 pressure points from here to the elbow. Both thumbs are used, a thumb over the thumb, the other fingers gripping the arm. 1, 2, 3, 4, 5, and 6. This procedure is repeated 3 times. Next come 8 points from the first point of the lateral forearm to the wrist. Both thumbs are used and a light pull is exerted on the arm. 1, 2, 3, 4, 5, 6, 7, 8. Repeated 3 times. 1, 2, 3, 4, 5, 6, 7, 8. Once more. 1, 2, 3, 4, 5, 6, 7, 8. Now the hand, starting with the thumb, exerting a light pull as the pressure is applied. Now for the side of the thumb. And the procedure is repeated for each of the fingers in turn. Now change the hands. Ring finger. Little finger. Now the hand is turned over and pressure is applied to the depressed center of the palm 3 times. 1, 2, 3. After repeating this 3 times, the wrist is gripped, the arm firmly pulled, and the practitioner now moves to the head. The arm is worked on, and then it is lowered backwards. When it has been lowered all the way, it is pulled firmly. After pulling, it is returned to the vertical position, lifted firmly, and then released or dropped. This concludes the upper limbs. Now for the head. The pressure points for the head are on the median line. There are 6 pressure points to which pressure is applied from the hairline to the crown of the head. Place a handkerchief on the head before carrying this procedure out. 1, 2, 3, 4, 5. Pressure is applied to 3 points starting from the crown to left and right. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3. Repeating this 6 times, once again apply pressure at 6 points along the hairline. 1, 2, 3, 4, 5, 6. Pressure should be applied to the 6th and last pressure point slightly more firmly than the others. This concludes the head. Next is the facial region. First apply pressure to 3 points on the median line of the forehead. The practitioner raises his hips and applies pressure with both thumbs. 1, 2, 3. 1, 2, 3. 1, 2, 3. Now the practitioner lowers his hips and carries out treatment on the nostrils. 2-finger action is used. The middle fingers are placed on the index fingers and the fingers are placed together to form a small circle. Pressure is applied to both sides of the nostrils simultaneously. 1, 2, 3. 1, 2, 3. Once again. 1, 2, and 3. This treatment is effective for empyema and rhinitis. Next is shiatsu for the cheeks. The 3-finger action that we explained earlier is used here as if to lift the cheekbones, and it is essentially a form of cosmetic treatment. 1, 2, 3. Repeated 3 times. 1, 2, 3, 1, 2, and 3. Now for the eyes. Holding the forehead with the right hand, apply pressure to 4 points using the left hand starting from the lower socket. 1, 2, 3, 4. Upper socket. 1, 2, 3, 4. Temple. 1, 2, 3. Now the other side with the right hand. Lower socket. 1, 2, 3, 4. Upper socket. 1, 2, 3, 4. Temple. 1, 2, 3. And finally, a handkerchief is placed on the upper part of the face for palm pressure on the eyes. Palm pressure is used here, in which pressure is applied steadily by the palms of the hand, taking care that no spaces are formed between the fingers. Count up to 10. 4, 5, 6, 7, 8, 9, 10. This completes facial shiatsu. The last shiatsu therapy is for the abdomen. When carrying out abdomen shiatsu therapy, the patient's hands should be crossed lightly on the chest. This is the stomach, the small intestines, this is the bladder, this is the cecum, this is the liver, this is the spleen, this is the sigmoid colon, and this is the rectum. First, palm pressure is applied to the stomach, the small intestines, the bladder, the cecum, the liver, the spleen, the sigmoid colon, and the rectum. Next, using both hands, pressure is applied starting from the pit of the stomach. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Now place both hands side by side, apply them to the stomach with the elbows stretched out, and pull and push the stomach. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now apply palm pressure straight down. Apply the pressure in a circular motion. This is circular palm pressure. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now place a hand on each ilium and then apply pressure. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And finally, place the hands under the body and apply upward pressure as if to lift the stomach area. 1, 2, 3. Now place the hands on the navel, one on top of the other, and vibrate them just like an electric vibrator. And then count to 10. Remove the hands gently, and that's it. This completes the basics of shiatsu on all parts of the body. Remember these basics correctly and practice them. Take care not to allow the nails of the fingers to dig into the patient. Do not jab. Put yourself in the patient's position and always remember the basic philosophy. Shiatsu is like pure maternal affection.